Welcome everyone to another episode here, Jaws Podiatry. We have a very young patient who has presented to our office for the first time with a chief complaint of elongated bilateral second digits. Let's take a look at the left first. So, as everyone can see, again, let's not look at the third today, okay? Let's focus our efforts on the second. The proximal interphalangeal joint and the distal interphalangeal joint both reveal these calluses. In addition to that, you can't really appreciate it. I'm going to have the patient sit and you guys will really see she really has a long toe. Again, we go back to the Morton's type foot. This is exactly what we mean. The right one is actually even longer. How much longer? You guys will see once she goes, when she sits down on weight bearing, but she also has a little bit of a mallet toe, right? The mallet toe is when we see this, right? That the tip of the toe is bending down. That's why you can't really appreciate. But look at the difference between the third and the second, right? There's this big gap. And like I've always said in the past, in all of our videos, we don't really look at the great toe. We always look for what? The parabola, right? The parabola starts here. Okay, once this is shortened, we're trying to move this toe back a little bit to make sure that when we start here, right, we always draw it out, that it's nice and natural, right? Same thing here. We start here, and then we'll shorten it, I suspect maybe 3 or 4 millimeters just to push it back a little bit. This one's a little bit better. Let's have the patient sit here a second so that everyone can really... So everyone can tell here, the toe, right? I want everyone to compare now. This is the toe straight, right? Now you can appreciate the difference. The difference between the tip of the second and down here. Let's take a look at this one as well here. So that kind of gives everyone an idea. There's a very, when it comes to toe shortening, and I've said it in the past, toe shortening surgery is very delicate, very intricate. It's essentially artistry at its finest. Everything, every millimeter, every little thing that we do counts a lot. So, you know, we've sat here, we've spoken about pretty much everything, and we go back to the 90-10 rule. The 90% is what the patient does after. The 10% is my portion. And it's extremely important that as clinicians and physicians that we choose the patients that we know are going to be compliant, that they're going to follow all of our instructions, because this is an investment not only for doctor but also for patient. And I think she's a great candidate. She's in the field of medicine, which makes it even better. She works at a plastic surgeon's office, so she's a very she's, you know, in tune with what we do. I will keep everyone afloat on if the patient decides to pursue, which I think she probably will, and for sure. And we will definitely probably videotape that as well, so you guys can all see what what the procedure also entails. So like always, www.jawspodiatry.com, Instagram Dr. ToeJam, Facebook Jaws Podiatry, and last but not least, our YouTube channel Jaws Healthcare. Thank you for watching.